we are not counting the private ones. Currently, we have 109,020. And this is a clear increase, including the one for ICU. When we had COVID, ladies and gentlemen, we only had 114 beds nationwide. And that's why we were not able to cater for those emergencies. But this is basically increasing as we speak. The other thing that also is very clear is that our CHPs, all of them, have smartphones. 100,017. Already they have smartphones. And we have gone to places like Lamu, distributing them with the Minister for Health. We have been to Kwale, we have been to Kilifi, we were in Kericho, if you remember. So it is not, this is your story, this is story is a Jaba. Already those people have phones, so they can actually have contacts, they can take information, they can relay, and we are also using technology to even give feedback so that we know what are the prevalent conditions going forward. And it will be very much wonderful so that we get a lot of information in advance so that we can actually prevent some of these diseases and also to promote well-being. So, and I really want to thank our governors because they are collaborating in this. They get a 10,000 shilling month stipend, 5,000 from the national government and 5,000 from the county government. So we really must appreciate that collaboration of the two tiers of government. And these funds will also help in terms of tracking information concerning health in all households in Kenya. It is also good to say that under the Linda Mama maternity program, the numbers have increased to 638,541, ladies and gentlemen, accounting to 30% increase. This further underscores our commitment for reproductive and maternal health. So you can see very clearly, Kenyans give, on average, 1 million babies a year. And this Linda Mama program is therefore very important in ensuring that maternal, pre, peri, and postnatal care really works very, very well. And we really also like to say it's not just for anything, but it is very important to have a healthy population and that we get more Kenyans, because when you have them and they are healthy and they're delivered in hospital, we are able to track the maternal health of the mother and the child and ensure that all of them are safe. But also, it ensures that then our country has people, the workforce, which is a human resource that's the most important capital for any country's development. And we must also complement those governors who are also assisting in this, like my good friend, Honorable Irungo Kangata, who has a similar program in Kangata Care, where he actually incentivizes mothers by giving them a certain amount of money when they have to go for their clinics. And we encourage all of the governors to do so. And you can see, you start from the time a child is born, going all the way. Further, for the last 16 months, ladies and gentlemen, the government has been able to increase job creation in the formal sector of the economy from 2.9 million, these are people who have a salary, to 3.1 million jobs. So you can see there's an increase of 200,000 jobs in the last 16 months in the formal economy. Yule ambaye anapatiwa payslip ndio hii. In the informal economy, which employs more people, that is something that is working in progress because that employs 85% of our population. This translates to 6.9% growth in job creation. So 200,000, 6.9% growth, with more jobs on the way as the government hasn't entered into agreements for labor exchange with several foreign entities, including the recently advertised 2,500 positions for nurses in the Kingdom of Saudi Arabia. It is good to note that in the health sector, we have more than enough workforce, for example, to meet both our domestic and export labor. So the idea that people are saying, oh, if we export our nurses, are we going to remain with people, hospitals without nurses? No, that's not true. We have more than enough capacity because one of the things that we have been doing, we do not link the courses at our various public institutions, that we train people and what the job market requires. So we are always getting a surplus of this. And even in our next briefing, we'll give you the figures. How, for example, now our universities have got over 300,000 students. And every year over 100,000 graduates from those universities. So we have more than enough. And export labor has since then become a very important aspect of our foreign exchange earner. Last year alone, we earned 624 billion plus from these remittances. And we are the third country in the world that has received that kind of money. So you can see we have export labor, people bringing in the dollars, so that then we can, we can do well with our economy. The Enhanced National Social Security Fund, NSSF savings, have actually grown, listen to this, from 1.4 billion shillings to the current 6.5 billion. This is a very good saving culture. When we took over as the Kenya Kwanza administration, our average national saving culture was only at 7% of any payslip. But if you go and look at other jurisdictions like China, the Chinese save up to 55% of the money that they earn at an individual level. So this increase is by 360%. It is unprecedented, and it is going to help us in terms of even taking care of our older parents. And all of us here at some point will be old. All of us here, some older parents who may be ailing, who may not be able to work the way they used to when they were taking care of us. And so therefore, ladies and gentlemen, this is very, very welcome. And also, in case these resources need to be invested, then Kenya doesn't have to go out there to look for other financing because these monies do exist. And of course, therefore, it will also help in the facilitation of other national programs so that then we all benefit in terms of self-sustainability. Then another very interesting thing that has happened within the last 16 months, ladies and gentlemen, under the Kenya Kwanza administration, is that those beneficiaries of the Inua Jamii program have been able to be increased from 1.2 million people to 1.9 million people. So this administration, under President William Ruto, has been able to add a whole 700,000 Kenyans who earn a minimum of 2,000 shillings every month just to supplement their income at the household level. And these are orphans, and there are many that are in our society. Maybe there are some who are even in this room. They are, vulnerable people because of where they live and their backgrounds, and also children, and also persons with severe disabilities, and also older persons, our senior citizens. So this program is extremely important. 700,000 people are smiling, and they are receiving their money not through chiefs as it used to be before. Now we are using M-Pesa. So they are saving money, from their daily hustle, from going from one, to go to the county headquarters to pick money. Now it is coming straight to their phones. And that is extremely important because that helps in terms of building our local economies. And also something called asset building. Because if you save your 2,000 shillings every month, then you can buy a goat, you can build a house, wherever. So asset building, and that is creating local wealth, for these families. And that has been happening for quite some time. Please remember that this Inua Jamii program is unconditional, grants, and also there's a component of health, so that then people can also benefit from the social health insurance fund. The other issue that I also want to touch here, and I need to put it very across, as a representative of persons with disabilities, is that the registration of persons with disabilities is now going to be done by directors of health in all the 47 counties, because earlier on it was being done here at the national level, and this will help a lot of unregistered persons with disabilities. The agony of traveling all the way from their villages when they have mobility difficulties like wheelchair users to seek verification and signing of their disability medical assessment reports by the National Director of Medical Services. In fact, we've been having a backlog at Afya House. So now that will be a thing of the past. It will be done in conjunction with the county governments, the Directors of Health. And then also this centralized system of registration has really disadvantaged many persons with disabilities, and therefore denying them the benefits as per the law. Because the challenge there is If you are registered, you can get tax exemption. If you are registered and you have a group, you can get a grant. If you are registered and you are a person with disability, you can get an education scholarship. If you are registered, you can also get an assistive device like a wheelchair, crutches. If you are registered, you can be given prescription glasses or sunscreen for those with albinism. So really, many now can actually benefit because this data now will be properly captured by the National Council for Persons with Disabilities, which as at now, after 20 years of existence, because it was started in October 2004, and I was privileged to be a pioneer board member there, only 580,000 people have been registered against the estimated number of 6 million Kenyans with various forms of disabilities. So this is really attributable to persons with disabilities who are eligible, shying away from registering, I beg your pardon, because of the long and arduous process, and the uptake, therefore, becomes very low, but now it's going to rise. So we are calling upon all persons with disabilities across the country, please go and register so that you can benefit from this. The process has also been shortened by the government's move of onboarding the disability registration services on the eCitizen platform as per the presidential directive. The online registration system is aimed at collecting accurate socioeconomic data for persons with disabilities right from the ward level. Eligible persons with disabilities can now register themselves from the comfort of their homes or smartphones, as long as they have a smartphone or a computer, and they have a signed health assessment report from the Director of Health at the county level, backed by a national identity card or birth certificate and passport size photos to be uploaded. The action saves the person with disability more time, as they need to travel to county headquarters for their services. Already, 3,091 submissions have been made through the eCitizen platform by persons with disabilities since activation in only 1 month. So if you have 3,000 already, you can even round it to, say, even 3,000 alone. If you are to do in a year, then you can see the numbers, how they'll actually escalate to about 100,000. Yet, in 20 years, we've only done 580,000. So this is the way to go, and that is why we are calling upon Kenyans to also use the eCitizen services so that they can have Gava Mkononi. Cognizant of the possibility of reversing the gains that Kenya has made in promoting disability inclusion, the government will be in the next cycle of government performance contracting reinstate the disability mainstreaming performance indicator, which had been removed and retired from the performance contracting from all ministries, departments, and agencies. This is a very great gain because that is the one thing that was making all the ministries, departments, and agencies to have a program and action on persons with disabilities. Also, further to it, I am glad to report to the nation that the disability support allowance for all public servants with disabilities has been revised by the Salaries and Remuneration Commission to include more types and categories of persons with disabilities, such as those with low vision, including albinism, and those who draw print nearer to the eye, those who use 2 crutches or walking frames. So the government urges all employees within the public service to take note of this new development, because they'll be earning an extra 20,000 shillings for their personal aids, and for persons with disabilities who qualify, as enumerated above, to contact their relevant employers in order for them to benefit from this very empowering development. So it's an extra 20,000 shillings that will help them to get somebody who can assist them. And this is very, very important. So please, watu walemavu, now you have that. And we keep on reviewing this with the SRC. These are some of the things that we spoke about in the Disability Economic Charter